Okay, this is a super fun episode of the Ortho Show podcast. We're bringing on Jason Rand, the OG of orthopedic surgical PAs. I've known Jason for a long time. He's been in the business for 20 years. We have a tremendous overlap in our industry and the things that we do together. His personality is absolutely infectious. He is an inspiration to PAs across the country, whether it's medical device design, working with industry as far as a spokesperson, or professional education as a co-chair at the Orthopedic Surgical OSET meeting. He's just an amazing person to listen to. You're going to love this episode. I know I did. Dr. Scott Sigman, hashtag follow the fro.
From medical media, this is The Ortho Show.
Hello, world. Dr. Scott Sigman, your favorite opioid-sparing orthopedic surgeon, here for another episode of the Ortho Show podcast, where everyone knows we bring you the best of the best in the orthopedic space, and today is absolutely no exception. We are super happy to have our first orthopedic PA on the show, Jason Rand, who works at the Boston Sports and Shoulder, who's an orthopedic PA who specializes in sports medicine. He works with Dr. Brian McKeon. And as far as I'm concerned, he's a dear friend and colleague, and he is the OG of orthopedic PAs. What's going on, Jason?
Oh, Dr. Sigman, thank you so much for having me. I couldn't be more excited to be on the show. Been a fan for years, and this is like this is like a goal in life. Like my mom's gonna listen, and she's gonna come in. The family, I'm gonna get messages from people. It's gonna be great. I couldn't be more excited.
You made it to the big time, Jason Rand. You are not kind of a big deal. You are a big deal.
Oh, I'm up here with legends that have been on the show. Legend.
I love it. So let's get going. Well, we've known each other for a long time, and I say you're the OG of orthopedic PAs. I've got to throw in a little love to Kristen Proverb, but she's a nurse practitioner. She works with me. She's the OG of orthopedic nurse practitioners. Are we good with that?
I totally agree with that. She's amazing, wonderful person, and just so very talented.
Yeah, no, I love it for sure. So, all right, we always start at the beginning, right? So tell us where you were brought up and when this whole idea of becoming a physician assistant in sports medicine and all that, where did it come from?
So a little bit of history of me, and I promise you I won't take the whole show to talk about me. So I grew up in Belmore, New York. That's on Long Island. And I went to Northeastern University after I graduated high school. I studied physical therapy. Got my master's there. When I moved back to Long Island, became a physical therapist. It was when I was working as a physical therapist, I got to see, I was inpatient in a hospital, the orthopedic floor. I got to experience what the PA profession was all about. And so I got to see the PAs changing medications, assisting in surgery. And so that changed my career choice. And so I went to Cornell University in Manhattan, their PA program. It's a surgical focused PA program right next to HSS. Sloan Kettering, right in that medical area, New York Presbyterian. It's just like a mecca of orthopedics and medicine in general. Met my wife at PA school. She's from Rhode Island. We moved back. I started a job at the Baptist, and I've been working in Boston as a PA ever since. Now at Boston Sports and Shoulder Center.
I love it. So where was the impetus to become a physical therapist, early on in your career? Obviously, you go to Northeastern, you're thinking about a pathway. What drew you to that as you were growing up?
So, it's interesting. How do you choose your career or your pathway? And it wasn't an experience that I've had with myself or with a family member needing to go to rehab. It was more of just looking at different career choices and taking a patient that is, neurologically disabled or debilitated and turning them into where they want to go in terms of function and activity. What kind of drove me? And so I visited a few places that provided care for patients with cerebral palsy, some patients that recovered from surgery. It was a candy striper. I went around the hospital with the red and white candy striper thing. I mean, now that's...
Do you have any pictures down the back wall? I don't see anything back there.
I think they're all gone.
Probably a good thing, but that's okay.
And so we're just working at the hospital and kind of seeing what's out there kind of drove me to go into healthcare. Yep, and physical therapy.
Awesome. Northeastern was an amazing school. I mean, incredibly difficult to get into, and with the externships and all of the pathways that you could have to various careers, that was a great choice. But then, it's interesting. You go and you start seeing there's a little different aspect of things that could go on, and you follow the physical therapy pathway, but then you're watching the PAs and the responsibility that they have, whether it's in surgery or caring for patients and, helping to make decisions. And then off to Cornell you go, and then back up to the Baptist. Now, when did you start at the Baptist?
So I started in the Baptist in 2004. Worked there. I was the sports medicine PA. So I worked with all the attendings, all these legends, and
shout them out, dude. That's what we do here. That's what we do best.
Yes, absolutely. I mean, Brian McKeon was such an inspiration for me, and that's to come in my career. But Arnie Scheller, Glenn Ross, Mark Steiner, who recently passed away, unfortunately, but what a wonderful person. And Hank Tozlowski.
The Taz, what the bowling ball of a Taz.
I mean, these were legends, and I kind of grew up there, and that started my career into realizing that, yes, I'm a PA, but I could be so much more than that. I can go to these conferences and I could learn so much from them and from the conferences, and I can, expand beyond just being the PA that's here from 8 to 5 or whatever it is. And so I worked there for about 2 to 3 years. I still consider that home, the Baptist, but worked consistently with Dr. Brian McKeon, and he's since become a mentor for me and just a real inspiration. He brought me into his practice in 2007, Boston Sports and Shoulder, BSSC, and I've been here ever since. We started with me as the one PA. Now we have about 14 mid-levels, 2 nurse practitioners and 12 PAs.
That's fantastic. And, it's interesting. So I finished up at the Baptist in 95, I guess. So we were 10 years apart by the time you had started, but all of those names are just, great names for me as well. Having spent, of my 4 years in residency, probably about 9 months were spent at the Baptist, some on the sports service. So, just a tremendous breeding ground for learning and education, from true great leaders in orthopedic sports medicine. So Brian in 2007 was also taking care of the Celtics at that time, right? That must have been a big draw for you as well to go to work with Brian.
Absolutely. At that point, that's right. He was taking care of the Celtics, and I have been to. He's always very generous with tickets, so I've been to a few games. And when I joined on to him, he put me in the path of becoming one of the members of the medical team. So I had a medical ID for the Celtics. I covered some of their games. He likes to tell the story that he had me sitting on the bench at a few of the third quarters of some of the games. There I was on the bench. And which is an amazing honor. I think he was standing on the sidelines laughing at me when I was on the bench, because that's a stressful spot to be in.
I love it. I love it.
And so, but it was him giving me the ability to kind of cover these games and to treat these amazing athletes. I'm just humans at the best potential of what we could see. So that was just a absolutely amazing experience. That was some of the peak events of my career, is taking care of these players.
Yeah, and it's it's interesting. What I really like about you, Jason, in the way in which you've taken command of your career. You said it, like, as a PA, you have choices, right? You can be a 9-to-5er. You can work at an urgent care. You can work at a doctor's office. There's a lot of different specialties, right? You could work in the hospital as well. But I think that you and I are kindred spirits in many ways, in that, that wasn't good enough for you. You wanted to sort of expand and do more things and reach out and really accomplish as many things as possible. So obviously, being a part of the Celtics, getting a Celtics NBA championship ring, I'm assuming, there along the way.
No.
The no ring?
Oh, too low.
No,
Yeah.
come
Oh
on,
gosh, I
guys.
wish. I
Oh
know.
man,
I
that's
know. I should hold that against McKeon, but
totally.
he lets me touch his every now and then.
Oh my God, Brian McKeon, you are banned from the Ortho Show until we get Dr. McKeon. No, I'm just kidding, Brian. You're welcome to come on. We would be thrilled to have you. Have amazing stories. But but that's wonderful. But so that was one aspect of it, right? And then, but just let's for our listeners, because I don't think not everybody is familiar with the day-to-day life of an orthopedic PA and what goes on. So let's go through that. I think that'd be fun for the listeners to hear. Like, what do you do on a day-to-day basis as far as taking care of patients?
Absolutely. So, I couldn't be more proud to be a PA. Throughout the training at Cornell, it's been amazing. My rotations have been amazing, and my career path, I think, has been just amazing. When people say, I became a PA because I want to have family and I want to, which is wonderful, and I want to, it's more lifestyle choices why I become a PA. There's nothing that that's something that I kind of agree with, but it's like you're a PA. You can still do all these things that you want to do in your profession. You can still work with companies and develop great instruments and bring this healthcare into the future, right? And not just sit and see patients and get out by 4:30 or 5, right? It's counting on us to do that for the PAs that are coming behind us, that are graduating school, to set the standard. So at BSSC, we see our patients. We see patients that come in through the door, need new evaluations, their follow-ups, maybe second opinions. If a patient comes in and they want to see an MD, then absolutely they'll see an MD. If they want to see me and see an MD next, they'll absolutely get that level of care. But there's a lot that we can do as PAs in orthopedics in terms of taking care of the patient. And so that's the role that we play here. We assist in surgery. We treat patients in the office. We call back patients at the end of the day to make sure that all their questions are answered and that they're totally comfortable. When I treat patients with Dr. McKeon, when he sees a patient and they need a further explanation or more time, I'll spend time with them while he can go into another room. So it leaves patients with a fully informed understanding of their level of care in terms of whether it's a surgery or whether it's conservative management. And I found throughout my years of doing this, which is now 19 or 20 years, which is insane, is that
Crazy.
Patients are very comfortable seeing a PA. And it's become more and more of a standard in healthcare that I may not get to see the doctor, but I'm going to get wonderful care. And if I am a confusing case, then absolutely you go off to the doctor who's has been through fellowship, been through residency, has years of experience. And so I don't think it's possible to run a private practice without an NP or a PA nowadays. That's just the way healthcare is designed. And so it's a wonderful profession. It is like any profession. It's what you make of it. And I just, we'll talk about this further, but I can't talk more about pushing the PA to work with companies on developing devices and go to conferences, educate, learn, and make this a absolute career, not just a job.
I think that's incredibly well said, right? So, and we'll talk about some more of this as we go, about the other extracurricular things that really help to stimulate your brain and keep you excited about work. And I couldn't agree more. And there's a lot of different ways in which PAs interact with physicians, right? With Kristen and I, it's a very similar feel. At this point, I've been in practice for 25 years. There's patients from all over that want to see me. We do the best to see as many patients as we can. But, if I were doing it by myself, it would be even more limited. So by having Kristen, we can see upwards of 30 to 40% more, more patients than we could if I wasn't. And then it's smooth, and and the messaging and working together with the same person. I mean, you and Dr. McKeon have been working together since 2007. I mean, you guys know what you do with each other. You work well with each other. And so I think patients understand that. And then it's the faces. It's Jason and Dr. McKeon, and it is what it is. And same with Kristen and I. That's really worked out well for us. All right, so let's talk about some of the things that you and I have had some fun together on. And you don't typically see a physician assistant reach out and become a part of industry and become a spokesperson, right? So obviously you're gifted. I mean, our listeners now know why you're so popular, Jason. Your personality is infectious, and everyone, you just want to go like, let's go with Jason. It's awesome. He's a great guy. But we've worked together on a couple of platforms with Flexion, which is now Pacira, for Zilretta, which is a long-acting corticosteroid. This isn't a commercial today. We don't have to get into all that stuff. But isn't it fun, when you go out with like these, like Rod Woodson and Michael Ruzioni, and you're hanging out and you're teaching and meeting people? It's a cool experience.
It is an absolutely amazing experience. It is fun. It's fun meeting the different PAs, NPs, and docs throughout the country when you go to these different lectures or seminars. It's fun traveling with people to discuss it. And it's fun teaching something new to your colleagues that may not have known about this product. It's not so much promoting it for a company, but you're promoting it for the patients that could benefit from this care. And so, for example, with Zilretta or even ortho laser or such, there's a little plug there.
Hey, ortho laser. Get them, it's open. Woohoo!
But it's for treatment of osteoarthritis. We don't have very many options for it. We can manage it, and it's the same options you've had for years, right? Steroid, weight loss, strengthening, bracing, and of course now we're exploring biologics with PRP and such. But it's like now that there's these other options for our patients, so it's a matter of getting the word out to your colleagues. And so it is fun. It takes it's not mundane. It's a blessing to see the patients in the office, and it's an honor every time they walk through the door. But if you see 40 patients a day for 5 days a week, you start to kind of, maybe lose your mind a little bit. And I say that in jest, but so if you balance that out with traveling to different places, meeting other PAs and educating, and just being excited about these new aspects of care, then it just adds to your profession, your experience, and your drive to continue to treat patients. Yep.
And you want to learn as much too for yourself, right? I mean, being able to go to these conferences, and we'll talk a little bit about that in a minute as well, but in order to provide the best possible care to your patients, you have to be constantly learning about the new available techniques and that are out there. Then you master those and you want to share. And so what a great way to live, right? To be able to keep you stimulated, keep doing exciting things, and be able to share all these ideas.
Absolutely. Couldn't agree more. We're learning every day.
So one of the other things that you and I share a lot of excitement with is professional education. And, I love it. You're the co-chair for advanced practitioners at OSET, which is, we're going to give out a big shout out to Brian Bisconi and Kevin Blanchard, Beth Best, and all the team at OSET as well, Stephanie Peterson, that, what an amazing conference it is. And now you have a major role there educating physician assistants and nurse practitioners. So tell us about that. What's the process like being at a meeting, which is, primarily probably a physician-driven meeting, but yet you guys are there having a say, learning as much as you can as well?
Yeah, I couldn't be more excited and proud to have that role. It is a matter of designing a day or 2 days of education for your colleagues. And so, what would I want to learn? What would I want to gain from a conference, from a lecture series? And so we've developed just an amazing algorithm, amazing agenda that people are going to just really have benefit from. And so the fact that I'm able to put that together is amazing. It's wonderful. It's a wonderful course. It's wonderful. Why is it so great? Well, because it's not made by an academy, right? So we can have Arthrex come and talk about what Arthrex is and their ideas and concepts. And which is wonderful because they're the ones making the product. So it's nice to actually hear from the vendors as opposed to hiding them in the closet and saying that we're not influenced by them. So this course is all about new technology, and I'm all about learning new things. We have to be, right? We can't be set in our ways, new techniques, new ways of doing things, new equipment. And so I couldn't be more excited to be in that role. And so it enables me to develop an agenda of professional activities for PAs, nurse practitioners, as well as new equipment, new techniques and approaches, and ultrasound. We're going to have a full day of ultrasound with Don Buford, another legend, who I just saw a nice LinkedIn picture with the two of you, which was great. A wonderful person and a legend in the field, who, it's funny, I learned about the Buford complex way before I knew who he was. And I kind of put it together in my first 2 years of practice. I'm like, that's that Buford guy. And so,
well, you first of all, you're giving away all of our company secrets, because we have Dr. Steven Snyder on this Thursday is being released, and that's where the Buford complex comes from. But we don't want to give it up today. We don't give up the story. That's going to come out in the next couple weeks. But you're right. Donnie is just phenomenal with his ultrasound techniques and the way in which he teaches and professes. And so, again, the passion, you can just sense the passion in your voice, for education, and what an important, leading role it is for you as well. There's a few other things that, I wanted to talk to you about specifically, which I know that you're also, very passionate about. And one of the things that I think that really is so incredibly valuable, as a physician assistant, is the ability to be on the front line of the important treatments that are out there. And really, you've had the opportunity with Brian as well, Brian McKeon, to be able to push into the envelope of orthobiologics, which honestly, you were doing well before the vast majority of orthopedic surgeons in the Boston area. We have a joke that we say on the Ortho Show, right? That a lot of medical information gets out of Boston, but not a lot gets in, right? And so, but tell us about where you are with orthobiologics now, why you feel they're important in the treatment modalities, the fact that it's a patient pay model, which is what it is, and acceptable, and what's been your experience?
Yeah, there's no doubt the future of I think orthopedics, our profession. And by the way, I love that PAs are getting into pushing this knowledge and new information. We have to. We can't just rely on our surgeon mentors to do it. We got to do it as well.
You're on the front lines, and so to have the knowledge base of this important information, so that you can spend the time with the patient, as you said, as Brian and I are running out to the room to get see our next patient. You and Kristen are hanging behind and getting all the information out to the patients.
Absolutely. And you want your patients to leave fully informed of this. And so biologics, the future of medicine is biology, the body healing itself, right? And I hope that I see it in my lifetime, okay? But to get the body to heal itself would be amazing, right? As opposed to, if we could somehow prompt the body to cause some healing factors that can heal things, right? It would probably put a few surgeons out of business. Nonetheless, PRP, right? So we do a lot of PRP in my office.
What PRP? Judy's listening. What's PRP?
Platelet-rich plasma.
Thank you. Appreciate it.
In our office.
Thank you.
We do a lot of it in our office because, there are a lot of things that we manage that are tough problems that we don't have all the answers for. And so when you're treating a patient with, let's say, osteoarthritis, or let's say significant tendinopathy, and they're not responding to traditional means, what do we say to them? Well, we could say, look, just change careers, give up the activity or so. And that's unacceptable. It's unacceptable to our patients, and it's unacceptable to conceive. I mean, I sit up at night saying, can I tell this guy not to run? That's his passion. What can I do to get him to be able to run? And so when you try everything, your traditional treatments, and you're left without other options, PRP was excellent. And that's how we started. And so we started with that, and we kept doing these PRP injections, changing how we modifying different protocols. Do we do 3 injections, 2 injections, 1 injection? And over time, we've realized that, maybe we should start PRP a little sooner in our treatment algorithm and not just wait until it's the last step. So we offer it to our patients. We explain to our patients what it is, the technology. We explain to our patients that it is relatively new, and I don't have 1,000 studies that are peer-reviewed that say that it's a benefit. But if we want to try it, anecdotally, we've seen some benefits. Patients often, kind of want to take that on. So if you're open and honest with your patient, and you explain to them the risk, benefits, alternatives, and that it is still a research phenomenon, patients are, they respect that, and they're more than willing to try, because, the fact that it's insurance doesn't cover it and it's cash pay is not something that we should hide from. That medicine should be paid for, whether it's the patient or the insurance company. And so if they're willing to do it, and most people are when they're in pain, then they're willing to do it. But as long as you explain to them the risk, benefits, and alternatives, then it's a wonderful treatment. We've seen some great outcomes with PRP with certain patients. It doesn't work all the time, no, but what does? And so, we love orthobiologics. We wish we could go more into the next level of orthobiologics. But, I think that's more for research. And when we get some good data and information, I think sky's the limit in terms of getting the body to really heal itself.
Yeah, no, for sure. It's one of the things we hear all the time. Why is PRP not paid for by the insurance? Why is laser, not paid for, by the insurance? And the bottom line is that it's just an arduous process to get these things approved through the FDA. It's very expensive, large randomized controlled trials. Eventually, I think probably big pharma is going to be the way in which orthobiologics gets across the finish line for commercial insurance payment. Which is coming down the line. There are a lot of big pharma companies that are working towards that. But for now, I think you said it beautifully, which is we provide options. Patients want to keep moving. They don't want to be in pain. Not everyone wants to have surgery. Many people want to push surgery off if they can. And providing these alternative options really does make a difference for them. And you almost feel obligated to do so, right? Because they are available. And at the end of the day, what does insurance pay for now? A standard Depomedrol injection? I mean, you and I are big fans of Zilretta, which is a long-acting corticosteroid, which we've had success with, and I use routinely, as do you, which is covered by some insurance companies, not all. But at the end of the day, there's not that many things that are covered for non-operative treatment of arthritis.
And it's after they pay their $5,000 deductible.
Exactly.
You make a case that nothing's really covered. And so, the state of healthcare insurance-wise, disaster. And so, that's right. If you don't offer these technologies, then you're not doing your patient a service, arguably. And so you just want to explain to them, give them the options. Patients love options. You don't need to pick and choose their options, but you want to give them the options. You want to know that it's available.
Provide them the menu. Here's the menu of options that are available. Some are paid for, some aren't. What would you like to do? Negotiate a settlement and get the patient enrolled in whatever it is that they want to do.
The menu idea is fantastic.
We love that too.
And to get one in here, one fantastic in here.
Yeah, dude, we're going to keep you all day long. I love you, man. We're going to stay on for 2 hours. But no, so look, we're getting close to the end, but there's a couple of things that, the benefits, again, of being in a high profile, sports medicine practice as a physician assistant, and you've grown with experience in your 20 years, they trust you. People trust you. You're part of the team. You're part of the process. Can you do me a favor? Can you get me those shoes behind your head right there? Shaq's shoes. We don't have to talk about exactly what you did for him, but I don't think most people remember, but Shaq did play for the Celtics for 1 year. Was it 1 year?
That's correct. Yep.
I put it up to the side of your head because that's unbelievable. Go on.
There it is. It's humongous. Dr. McKeon's office is a museum of different shoes and such from his years with the Celtics. Still working with them. But we do have a picture of some shoes here, which are rather large.
That's just unbelievable.
I'm not going to hold my shoes up against these shoes. Let's just put it like that.
Now, it might fit my bunion. Some of my friends would be laughing about that. We could actually get my bunion in that shoe. But then, one of the other, people that we share is Mike Eruzione. Grabbed his shirt too. I can see his shirt there in the background as well. And everybody knows Mike was captain of the U.S. hockey team from the 80s when they beat the Russians. And you know Mike very well. You were integral and involved in his treatment for his underlying knee arthritis.
Yes, what an amazing person. Just really wonderful, wonderful person. I met his family. And he, he's just so thankful for the care that we gave him here, which of course is known that we've seen him here. And it's just one of those guys that you're just so glad that you met in terms of his stories, and he's just so inspirational.
He is phenomenal for sure. So look, as we're getting ready to close here, Jason, I want you to give some advice to our listeners out there that are thinking about a career as a physician assistant, as to the pathway, what they should do, how happy you are, et cetera. Give us a closing sentence.
Absolutely. Can it be a paragraph?
You can do a paragraph.
Okay.
We'll give you a paragraph.
So to all the surgeons out there and the docs, we're PAs. We're here to help you. That's our sole goal, is to help you. And so in many different ways we can do it. We love taking care of patients, and just give us the autonomy that you feel comfortable with, and we're there to help you in learning and to make you the best surgeon doctor you could be. In terms of my colleagues, go the extra mile. Get here an hour early, review your patients for the day. Don't get in at 8:08 for an 8 o'clock start time. Your patients, they love you. They're there for your help. They're not blessed to see you. You're blessed to see them and be involved in their care. And I truly mean that. And every day I wake up and I think that I'm honored that 40 people are going to come in and ask me for their advice. So, a PA is just such a wonderful profession, nurse practitioner as well. We're all part of this team to take care of the patients, and the team with insurance companies the way that they are. Patients need us as a team. And so it's an honor to be in medicine. It's an honor to take care of patients, and I hope that all PAs feel that way. And we just all make it as an international team to give the best care to our patients.
Jason Rand, you are an inspiration. I think your infectious personality, you are a leader in your field, and it is no surprise that you are so well respected across, the country as one of the leaders in orthopedic sports medicine. It is an absolute privilege and honor to call you friend and colleague, and I look forward to working with you always.
Same here. Thank you so much, Scott. Dr. Sigman, it's been amazing.
Amazing it is, Jason. You are amazing. This is Dr. Scott Sigman, #FollowTheFro, host of The Ortho Show. Till next time.